Good morning, beautiful people. And today I'm going to work again. I'm waiting for my Grab because I'm a little bit late today. So, Grab driver is here ready. See you later, guys. Yeah, the government has an initiative to get a swab for all those healthcare workers to make sure that we are all safe. We don't spread virus to everybody. So today I'm gonna get a swab. Good morning.
Good night.
Is it good night to you for you?
No need to go home.
So
Need to go work.
yeah, it's my working hour.
Is it?
Yeah,
I'm your boss. Go back and get.
yeah. I wish. Seatbelt on. And this is it. It's my time. It's my turn to take my swab as part of initiative of Sing Health. Oh no, it's just Sing Health. It's a government uh, MOH. Everybody must go for a swab. And it's not just a swab once. We're gonna go 3 times of swab, guys. So imagine this is the sacrifice that we've going to do for all the humankind, people. And yeah, I'm walking through there and I'm going for my first swab, which is I'm kind of palpitating. I'm kind of scared. Hashtags I'm scared. But what to do? This is the nature of my job, guys. And for the protection of others, at the same time to be very sure that I'm not a COVID positive, guys. So come and join me. And good luck to me. By the way, my husband said it's kind of painful, but it's okay. We just gotta do it. See you guys in a bit. And I'm already here and got a queue for my swab. This is it. Direct.
You take the tissue paper already?
Hey, I think I'm not sure whether I will bleed today. Last time I bleed, you know.
Oh, okay.
Yeah. I just done my swab, guys, and it's really, my gosh, I will tell you how I feel and how it is. So now I'm walking back to my department. Yeah, but it's really freaking painful, my goodness. But finally it's over, and yeah. I just finished my lunch, guys, and yeah, I have still a little bit time. So I want to continue. I still have 30 minutes and I still want to continue this vlog of mine. So what happened now, guys, in Singapore? By the way, forget about what is in behind me because I'm in my storeroom, which actually we use this room also for resting for all the nurses. This is a storeroom where we kept some of our medical items. Yeah, you notice that, guys? Yeah, so it's almost all we have is kept over here. So forget about my background. Okay, so as you know, I would like to tell you why we are doing this COVID swab testing, guys. Okay, so as I've mentioned early on from this vlog that Singapore actually managed a very good how do you call this? We managed very well in to stop the spread of the coronavirus for quite some times. I think a month we had a very few cases, and we are actually one of the country that is really controlling the COVID situation very well, guys. and I'm very very happy to that because I'm part of it. We are part of it as a healthcare workers, and yeah. So, but this situation is rising again, and in fact, just yesterday we had 24 cases in our community, and I think outnumbered of those foreigner who come to Singapore, the travelers. Yeah, so we still have that cases. So our government and MOH, the Ministry of Health, is really alarmed to that. So for the initiative, guys, since we are the frontliners, we are very prone to all the new virus or whatever it is. So we have to do a swab testing, guys, and it's just that is kind of a big thing for us because like me, I'm very sensitive to a swab. I did a swab last time, and it's actually I had a nose bleeding, and it's really hard to stop the bleeding, and it took about 15 minutes before the bleeding stops. So that's why it's not easy for me, but because for human being, for human race, and for everybody, guys, I will do it. Yeah, and I did it this morning. The all frontliners must have 3 swabs, consecutive swabs. So every week we have at least 1 swab, then followed by the next week a second swab, and then after that there's another one swab for us to undergo just to make sure this is a confirmation actually. Yeah, so after that, after the swab, we have another 2 weeks later, yeah, we have another chance of getting a swab again, guys. And yeah, so I hope that it's not really every 2 weekly, because so far for this time being they said that we have to have a swab every 2 weekly, guys. Every 2 weeks, 1 swab. Yeah, and yeah, why we are doing this is just that I've mentioned also that this is the initiative of our Ministry of Health, that we have to make sure that we are safe and our patients also are safe from us. Yeah, and it is not very is actually being in the news that one most some of our healthcare workers in the other hospital had a affected by COVID. So that's why, and we don't know which who got it first. Is either the patient or the nurse. We are not aware. We are not sure about it. But to make sure that everybody is safe in hands of the healthcare workers, we have to do it, and we cannot say no, guys. Although I have this hesitant because really I had a very bad experience last time when I had a swab, but because I'm a staff healthcare workers, I'm a nurse, I need to sacrifice my nose and also, guys, for my little ones at home. Yeah, so just be selfless. We don't need to think too much, guys. Okay, I will tell you also how it feels like during the swab. Okay, it's really really not a painless, guys. So it's just that you need to relax, and the swabs that was taken from me is both my nostril. I had once here and here also. At first it's actually just a fine thing. I will show you how it looks like. We have it here because we also do a swab to the patients. So I'll show you how it looks like. So we have actually 2 fine thing here. There's a bigger ones and there's a smaller one, fine and a non-fine one, guys. So I have these things. So these swabs are the one that they use for us. So this was the previously like this, a bigger thing, which is very scary. And this swab caused me a lot of bleeding. Yeah, so it will just goes into your nose. This is not a rapid test, so it will takes about 1 to 2 days before the results will come out. And there's another one. This is the fine one. You notice inside one? Yeah, so that's the thing that goes into my nose. Both nose is actually fine. So that's why it's just traumatic, guys, because a little bit of put inside into your nose here, and then after that goes behind your nasopharyngeal. which is behind your nose, back of your nose. So they have to go, and then a circular motion goes to you, and then after that slowly pull out, and the other nose at the same time as well. So it's kind of like the feeling is like you eat wasabi, a lot of wasabi, guys, not just a little wasabi, but it's a lot of wasabi to put, like, do you know that kind of feeling that when you eat wasabi is like very uncomfortable? Yeah, it's uncomfortable, guys, but this two, one is very painful and the other one is just uncomfortable, but of course I can still say that it's pain. Yeah, so this is a kind like it's a must because we need to be very sure. Yeah, so as a healthcare worker, as a healthcare professional, guys, I am willing to do it even though I'm scared. But I still remind you guys, this COVID is will run not very like it will stay with us for that long period of time. So we always remind each other to please take care of yourself. If don't need, not necessarily to go out, guys, please stay at home. Help us also to contain this virus spread by washing your hand, sneezing. Always remember, when you sneeze, even in your house, cover your nose because you are not sure whether you have the virus or not. Be very careful with the kids that you have at home, and of course your loved ones and all other people surrounding you. You are not very sure that you have not contaminated, or you don't never get this virus, guys. So always remember, it's just a few steps to remember, guys. First thing, stay at home and don't go anywhere if not necessary. Next is a self-distancing, guys. When you are in the public, make sure don't go in very close to each other, 1 meter apart only, guys. And next one will be mask up all the time. Wear mask wherever you go, and please stop picking your mask in the face. Do not hold it because you don't know where is this cute little finger goes to, and the danger of having the virus into you. And lastly, guys, always wash your hands. Alcohol or one hand washing, guys. Always remember these few steps. And I think that's all for today. I'm sharing to you because I want everybody to remember, and these things shall pass, but it's too long already, guys. We have to remember, war is never end yet. So COVID is just there. Stay safe and healthy, beautiful people. Thanks for watching this video, and to those who haven't watched my video, guys, please subscribe to my channel, Everyday MSTG, guys. And thank you for watching. Have a good day to every one of you. Bye bye, take care.